Hi, Kinesiology 3030. Today we are going to talk about the humeral-ulnar joint as well as the radio-ulnar joint. And in our second video for this week, we will also discuss the radiocarpal joint and the metacarpophalangeal joints and interphalangeal joints. So in short terms, the elbow complex, the wrist, and the hand. We'll talk about articulations, muscles, origins, insertions, actions. And then it is your job on the other side to start looking at these actions and thinking of exercise examples, activity of daily living examples, and sporting examples for where these muscles can be used. All right, so let's get going. First, we'll look at the humeral-ulnar joint. So this is our primary elbow joint. This is between the ulna and the humerus at the trochlea. So we're having this articulation here between the humerus and the ulna. We know that this is a sagittal plane hinge joint. The radius and the humerus articulate slightly. However, it's not a fixed articulation because the radius does move around the ulna. So our fixed or structurally stable area of the elbow is between the humerus and the ulna. In the second joint of the elbow complex, the radio-ulnar joint, we're looking at the distal and the proximal radio-ulnar joints. So at the proximal radio-ulnar joint at the head of the radius, just inferior to where the ulna articulates with the humerus, and then our distal radio-ulnar joint between distal radius and distal ulna. So these two will work together to allow the radius to rotate around the ulna. Remember, this is a pivot joint and works in the transverse plane. So revise on our movements. We know that there's only two movements allowed at each of these joints, and they are independent of each other. So at the humeral-ulnar joint, we have flexion and extension, and at the radio-ulnar joint, we have pronation and supination. So the elbow complex is made up of two joints, the humeral-ulnar joint and the radio-ulnar joint, which allows us to have sagittal plane movement, and then at our second joint, transverse plane movement. The humeral-ulnar joint is more proximal, radio-ulnar joint more distal, and then the distal radio-ulnar joint even more distal than the proximal radio-ulnar joint. So let's get started with our muscles. First one, we'll start with the flexors of the humeral-ulnar joint. We have biceps brachii. Biceps brachii has its origin on the scapula. For the long head of the biceps brachii, the supraglenoid tubercle, which is just superior to the glenoid fossa. And for the short head of the biceps brachii, we have an origin on the coracoid process, closely related to the pectoralis minor insertion and the coracobrachialis origin point. So on that coracoid process inferior to the acromion process and slightly medial to the humerus. Okay, and the insertion for the biceps brachii is on the radial tuberosity. Okay, so we're looking here at a muscle that attaches on the scapula and then attaches on the radius. So if we count those joints between the muscles, start counting those joints, we'll talk about it in a second. Think about what might be some actions for this muscle, looking at an anterior crossing muscle and a medial crossing muscle over the radio-ulnar joint. I'm sorry, medial to lateral crossing over the radio-ulnar joint. What do we see here with this anterior muscle? Okay, our first action, our primary action is going to be elbow flexion. So this muscle crosses over the humeral-ulnar joint. Anteriorly, we know that there's only two movements at the humeral-ulnar joint. The anterior is flexion, the posterior is extension. So elbow flexion is going to occur here. We're also going to allow for forearm supination because it's a medial to lateral crossing over the radio-ulnar joint. So if we are in a pronated position, biceps brachii will return us to a supinated position. And because it does cross the glenohumeral joint slightly, it will assist in shoulder flexion. So as biceps brachii crosses three joints, which would make this muscle termed as a triarticular muscle. So we're getting started into discussing muscles that start crossing multiple joints. A muscle that crosses one joint is a uniarticular muscle. A muscle that crosses two joints is a biarticular muscle. And a muscle that crosses three joints is a triarticular muscle or a multiarticular muscle. Okay, so start thinking about that as we move forward into how many joints muscles cross and what are their actions at each of those corresponding joints. The next elbow flexor we're going to look at is brachialis, which has its origin on the distal half of the anterior humerus, and then an insertion site at the coronoid process and the ulnar tuberosity. So this is proximal ulna, distal humerus, anterior over the humeral ulnar joint. So our corresponding actions will be elbow flexion, and that's it, because it does only cross one joint, the humeral ulnar joint. It doesn't cross the radial ulnar joint because it does not have an insertion on the radius, and it doesn't cross the glenohumeral joint because its origin is the distal humerus. So it's a uniarticular muscle, causes elbow flexion. Our next elbow flexor is the brachioradialis, which has its origin on the lateral condyloid ridge of the humerus, so distal humerus, and has an insertion on the radial styloid process laterally on the radius, a distal radius, distal humerus. Okay, so this muscle will cross how many joints? That's right, two. So it's going to cross the humeral ulnar joint as well as the radial ulnar joint, which will allow actions at the humeral ulnar joint, elbow flexion, and then it will allow pronation when in supination and supination when in pronation. Okay, so this muscle works to return the radius to kind of this neutral position between supination and pronation. So when we're in kind of this neutral hand position, neither pronated or supinated, that's when brachioradialis has its best line of pull for elbow flexion. But it will assist in those radial ulnar joint movements, returning it back to that centralized neutral position. So those are our three elbow flexors. Start thinking of some ideas of how you may incorporate these muscles in activities of daily living, exercises, and sporting examples. Now we're going to move posterior to the humeral ulnar joint, looking at triceps brachii. Triceps brachii has three heads. That's why it's called triceps. Three heads. Brachii means upper arm. So its long head is on the infraglenoid tubercle on the scapula. Okay, so just inferior to the glenoid fossa. So it does cross the glenohumeral joint. And then the medial head is on the distal third of the posterior humerus, and the short head, or the lateral head, is on the superior half of the posterior humerus. So these three heads will work together to cross the humeral ulnar joint and insert on the olecranon process posterior and proximal on the ulna. So thinking about this muscle, it crosses the glenohumeral joint and the humeral ulnar joint, making it a biarticular muscle at the long head and a uniarticular muscle for the medial and short heads. So what are some actions that we think may occur here? We have a muscle that crosses medial and posterior to the glenohumeral joint, and then crosses posterior to the humeral ulnar joint. So our actions at the humeral ulnar joint will be elbow extension, and then for the long head only, it will contribute to shoulder extension, shoulder adduction, and shoulder horizontal abduction. So it will bring the arm posterior, especially from a flexed position. It will adduct the arm, especially from an abducted position, and it will move the arm posterior in the transverse plane from a flexion position or more horizontally adducted position. But that is only the long head of the triceps brachii, which works as a biarticular muscle, but all heads of the triceps brachii allow for elbow extension. These are our primary elbow extensors, and then the long head is a synergist for these posterior and medial glenohumeral actions. Okay, next, we'll look at our second elbow extensor, or more smaller, or synergist for elbow extension, Anconeus. Anconeus has an origin on the posterior surface of the lateral condyle of the humerus. So it's posterior lateral humerus, and then its insertion is on the posterior surface of the olecranon process of the ulna. So it is posterior lateral on the distal end of both of the humerus and the proximal end of the ulna. So here's another example. So this muscle is inferior or sorry, more distal to the humeral ulnar joint. And its major function is really to just open up the space of the elbow, move the synovial membrane over to allow for elbow extension, but it also is a synergist for elbow extension, and it stabilizes the elbow joint and allows the ulna to articulate well with the humerus. But it's going to be our synergist primarily for elbow extension. It's more of kind of a small stabilizer for the elbow joint. Okay, moving more distally, we're looking at now more radio-ulnar muscles. For example, supinator. Its origin is on the lateral epicondyle of the humerus, as well as on the proximal lateral ulna. And then its insertion is on the proximal third of the radius. So any muscle that attaches or has an insertion point on the radius will move the radio-ulnar joint and crosses the humeral, or the radio-ulnar joint, and it moves the radius around the ulna. Okay, this is a lateral and slightly posterior muscle to cross both the humeral ulnar joint and the radio-ulnar joint. Any posterior radio-ulnar joint is going to cause supination, as termed the name supinator. It is a supinator of the radio-ulnar joint, and it will be a synergist for elbow extension. So it'll work a little bit in stabilizing the elbow, but its primary function is to supinate the radio-ulnar joint. Now looking anteriorly, we see Pronator Quadratus, which is on the distal radio-ulnar joint, has its origin on the distal fourth of the ulna, and then an insertion on the distal fourth of the radius. It looks kind of like a square. That's where the quadratus comes from. Pronator, it is a pronator, so it's anterior, moves from the radius to the ulna, insertion to origin, so it will rotate the ulna medially, allowing for radio-ulnar pronation. So its action is pronation. That's its only action. It's really there to cause pronation at the distal radio-ulnar joint, while Pronator teres, which is kind of the opposite to supinator, has its origin on the medial epicondyle of the humerus and the coronoid process of the ulna, and inserts on the proximal fourth of the radius anteriorly and laterally. So this muscle will pronate the radio-ulnar joint because it crosses anteriorly and diagonal over the radio-ulnar joint, and it will be a synergist for an anterior humeral-ulnar joint movement, which is elbow flexion. So its primary action is pronation, and then it will be a synergist for elbow flexion. Okay, so go through all of those muscles. We're looking at a kind of a smaller area with fewer movements compared to the glenohumeral joint and the shoulder girdle. So this is a little bit simpler, but now we have those concepts, we can really start to progress in our understanding of our muscles, their origins, insertions, and actions. So make sure we know our actions, make sure we know our origins and insertions, because that does give us our actions regardless, and start getting some examples prepared for class. All right, I will see you in lab. Thank you for watching, and have a great day.